Hello and welcome to Healthcare Cares. I'm your host, Trina Boyles, and today's topic will be preventative care. Now, everyone has a preventative care benefit. If you think you don't, call that number on the back of your card and let them know, hey, what are my benefits? What can I do? Because once you get your preventative screenings done once a year, it can prevent emergency room visits, long-term illnesses. So I would ask you to go. Now, the first thing is you go to your primary care doctor and he does a preventative screening and you go, wow, all of this was free. Now, others of you go to your primary care doctor only to find out that he's not in network with your health plan. Now, you may get a bill in the mail. You wonder, why am I getting this bill in the mail? Because preventative care has to be done by your primary care doctor or a doctor that's within your network. Always check, make sure you find out that this doctor is in network. Now, what follows under preventative care? You can go in for screening for your blood pressure, cancer, cholesterol, depression. And for those younger kids, you can go in because immunizations are free. That's a part of preventative care. Now, when you go in and you say, doctor, I come in for my preventative check, he may say, okay, I need a urinalysis. I need blood work. When's the last time you had a mammogram? He will ask you all those questions. But my goal here today is I want you to partner with your provider for your healthcare delivery. That is a must. Don't get intimidated because you're saying, oh, I have too many questions. No, ask those questions. You need to know those questions. Now, as a part of the preventative care, they'll send you to a lab if they don't have a lab in the office. And you go to the lab, they draw your blood, do a chest x-ray. You get a bill in the mail. You say, wow, why am I getting this bill in the mail? This is preventative care. They're telling me that it's free. I came to a doctor that's within network. Here's the clincher. The doctor sends you out for lab work. You go to where he sent you, not knowing that that lab or that imaging center is not in network with your plan. So let me help you out here. When that doctor tells you, your primary care doctor tells you, hey, I need you to go over and have a mammogram, or I need you to go have some blood work done. Before you go, you have your card with you. Call your customer service rep saying, hey, my doctor is sending me over to, let's say, ABC Lab. I don't even know if they're contracted or not. Your customer service rep at your health plan will look and say, oh, yeah, they are. Or either they'll say, no, they're not. Ask a question. Who is within the network so that I can get this for free or I'm staying in network? She'll give you a couple of, and before you go there, call your doctor. Call his nurse. Call customer service in the doctor's office and say, oh, wow, man, doctor, you sent me to a lab that's out of network, but I didn't go because I spoke to someone at my health plan not knowing that this lab you sent to me is out of network. So that's money I'm going to have to spend out of my pocket. And as I understand it, my preventative care is free. And let him know these are the labs that they gave me. Now I will go to this lab. And the doctor can say, okay, not a problem. Okay, how do your results get back to your doctor? Maybe the doctor has a relationship with that lab. Maybe they don't. So make sure when you go in for your lab work, your mammogram, your cancer screening, cholesterol, blood pressure, say, hey, look, my doctor referred me over here to you. I don't know if you're a part of his network or not. Give him your primary care doctor's name and number and say, please send my results to my primary care. That's the way you keep it within the network. Now, in healthcare these days, the cost is so high. But we can help the health plans by saying, I'm going to get my preventative care taken care of. This will help reduce the cost in the long run. Now you'll say, well, my blood pressure was high and I went to the emergency room. Okay, again, do your blood pressure at your doctor's office. Now, your primary care, if he's aware that you have high blood pressure, you're depressed, he may say, okay, Mrs. T, I would like you to come to my office every 3 months for a blood pressure check. Or he say, oh, I need you to come in every month, because he needs to know what is going on with your health to prevent these long-term illnesses. He needs to know. Now, when you call your customer service rep, also find out what services are covered under the preventative care. I don't want you to go and the doctor send you to do all these tests only to find out they don't fall under your health care benefits, under your preventative care benefits. And you're saying, oh, wow, these are not covered. Well, as long as your primary care doctor is in network, anything that falls under the preventative care will be paid at 100%. And at this time, you may get a balanced bill too for the things that were not covered. So I want to make you aware. Get out and say, what do I need to do next? Well, the buzz around town these days is everyone's talking about wellness, being healthy. We got to push that by taking care of ourselves, by getting your preventative care done. Okay? So you say, okay, I'm going to go and I'm going to get this done. This is a part of my benefits. I know of some employers that say, hey, you go in and do your yearly benefits. That's a preventative benefit. It's a wellness, and they will pay you. They will reimburse you just for getting that done. They're aware. So there's so many incentives out there to get the preventative care done. So you say, okay, I need to do this. I need to get it taken care of. And when you go into the doctor's office, let him know if anything's ailing you, if you have a family history of colon cancer or any type of cancer, if you have a family member or maybe 3 or 4 down the line that has breast cancer, let him know all of the diseases that are within your family, in that family tree. You got to let him know. So when your test results come back and you return to his office to get the results, or maybe his nurse will call you if something is totally not right with your results. Tell yourself, I got to go back in. That's a good sign. Don't look at it as being a bad sign. This doctor is like, hey, this is what's going on. We need to work with it. We need to find out how we can get it under control or preventing it from occurring again. So don't look at your preventative care in a negative way. It's really something that's so important, especially now. We need to take care of ourselves. You have employers who pay for these benefits through the health plans. You need to just reach out and say, hey, I need to have this done. We're just in the first month of the year. It's January. Go out. Find out what your preventative benefits are. Take care of yourself. Push forward. Any bad results, get them resolved. It's better that you know what's going on with your body so that you'll be well and you'll stay healthy. Go for them. Have any questions? Ask the doctors. Just know that preventative care will help with any long-term illnesses. It will prevent you from going into the emergency room or to an urgent care. Now, if you make those choices to go to emergency room or to go to urgent care and you receive this bill in the mail saying, okay, this was non-emergency. See, let me give you a little education here. Every time you go into the emergency room, it may not be an emergency. So yes, you will receive a bill in the mail. So I don't know how, but yes, I do know how. By using my podcast here today, letting you know, hey, go in. Don't go in an emergency room. You go in an emergency room, you might be there 2 or 3 hours for a blood pressure check or for something you feel is emergent. But your health plan may say, hey, this wasn't emergent. And they'll tell you when you leave the emergency room, follow up with your primary care. And you think, oh, they're just trying to brush me off. They don't want to deal with me or anything. Hey, look, it's non-emergent. So yes, follow up with your primary care. And I would do it the next day. If it's on a weekend, I would do it that following Monday. Hey, Dr. JoJo, I'm coming in to see you, or I need an appointment to see you. I was in ER over the weekend with high blood pressure. Again, this gives your primary care doctor. You have to remember the doctor that does your preventative care has to be a part of your health plan network. Always check on the health plan's network. If you go to a specialist, you're going to get a bill because he's not your primary care. A primary care doctor, let me share that part with you, is a gatekeeper. He is the gatekeeper of your health care. He should know everything that's going on. And then also, let me share something with you. If you have a primary care doctor and they're not, maybe you got a personality conflict. You just, you two are just not hitting it off. Call your health plan. Move to another one. We want doctors in our network to see our members and to help them succeed with their preventative care. And I want to just say, hey, thank you. And I do have another segment coming up next week. Check me out. I will be letting you know about the HMO, the PPO, and the deductible. All three. And what is the difference between those three? You have a good time and take care. This is Healthcare Care signing off.